All right, hello everybody, and welcome to the launch of SSDP at the University of Michigan's Drug Decriminalization and Addiction Treatment Campaign. My name is Matt, and I'm the president of Students for Sensible Drug Policy at the University of Michigan, and I'm a Master's of Social Work student studying policy and political social work. So we have a great event prepared for you all tonight, folks who are here in person and folks who are on Zoom. And so in the effort to get all of our cool speakers in, I'm going to speed through our intro pretty quickly. So we're going to move right along to our second slide. So as you can see, we're going to do some introductions. We're going to have remarks from Annie Somerville, who is State Senator Jeff Irwin's Chief of Staff, from State Representative Yusuf Rabi, Ashley Shukate from Public Health Awakened, Julie Barron from Decriminalize Nature Michigan, and we're also going to provide some general info about how to get involved in advocating for sensible drug policy. So that's our agenda. Who are we, you might ask? Well, Students for Sensible Drug Policy, SSDP, is a national organization which empowers students to end the drug war on their campuses, one campus at a time. It's been around for about 20 years and has been instrumental in drug policy efforts across the world. So that's us. And then real briefly, Annie Somerville, as we mentioned, is Chief of Staff for State Senator Jeff Irwin, who represents the Ann Arbor area. Yusuf Rabi is a member of the Michigan House of Representatives, representing Michigan's 53rd District, also represents the Ann Arbor area. Ashley Shukate is a harm reductionist and a member of Public Health Awakened, which is an organization which seeks to bring public health back to its radical roots. And Julie Barron is the co-director of Decriminalize Nature Michigan, which was pivotal in Ann Arbor's 2020 decision to decriminalize entheogenic plants. So that's who we are. But what are we doing here? We are here today to launch the campaign for the Resolution to Advance Sensible Drug Policy, or the RASDP. And I'm proud to have here our organization's policy director, Derek Frazier, who's going to give us just a quick little rundown of the resolution and what it would do were it passed.
Hi, my name is Derek Frazier. I'm policy director for SSDP at University of Michigan. So our resolution would assign possession of all controlled substances to the lowest enforcement of the lowest priority of law enforcement. We're going to no longer use money on enforcement and instead spend it on proven evidence-based measures like the distribution of Narcan in private businesses across the city and a scholarship program for evidence-based recovery housing programs. Progressives have said for years that drug use is not a crime, and with this resolution, they can finally put their money where their mouth is. We believe fundamentally that drug courts have not demonstrated cost savings, reduced incarceration, or improved public safety, and a new approach is ultimately needed. And now, Annie Somerville.
Hi, everyone. Can you hear me okay? Cool. So I'm Annie Somerville. I'm Senator Irwin's Chief of Staff. Really excited to be here to support your launch. First, I'll talk a little bit about Senator Irwin's involvement in drug policy throughout his career. I think many of you might be familiar with his work on the legalization campaign to regulate marijuana like alcohol, also known as Proposal 1 of 2018, which was successful. He's currently working on legislation to legalize entheogenic plants. That is Senate Bill 631 that we introduced a little while ago. And he's previously, when he was in the House, worked on legislation on civil asset forfeiture that was in part medical cannabis patients at the time were being targeted for their medical supplies. And part of the reason, just to circle back on Senate Bill 631, Senator Irwin started working on that legislation because the entheogenic plants offer treatment for a number of things: depression, PTSD, things like migraines, but also because there's religious and cultural significance of the plants. I think that I'll move on to why he supports this resolution that you all are launching. For starters, it significantly targets, calling an end to the war on drugs, and it minimizes it. from what I read, it calls to minimize unnecessary interactions with police, leading to decarceration, and really centering harm reduction and putting resources where they can be most valuable in the space in substance use areas. So it really, I mean, simply it makes sense. It keeps communities safer, and also, you know, the policy really centers around removing unnecessary harms that target communities of color and poor people. I know that Senator Rowan got to stop by briefly and talk to a few of you about kind of how to be successful on your journey, but obviously education and educating as many people as you can about the importance of this, both the social significance, but also the financial impact that it'll have on the local government, and really the best way to prioritize resources to focus on harm reduction, voting obviously, and really doing the work to destigmatize. I think that is super important, and so does Senator Irwin. And just to highlight some of the progressive policies that Senator Irwin is currently working on in the state Senate. He's been focusing a lot in the budget process on pushing to provide treatment on demand. I heard some of you talking earlier, and then the person before me mentioned drug treatment courts, and that's absolutely where he stands on the issue as well. People should be offered treatment when they want it. That works out best that way. We're also working on legislation to lower the legal age to purchase and consume cannabis in Michigan to 18. We haven't introduced it yet. We're in the office currently, we're working on ways to provide better testing for cannabis currently, and as well as the metals used in vaporizers. They're not really regulated. Two other things I guess I'll mention. In proposal 1, when we legalized cannabis, there was language around social equity. There's still some gaps in actually making sure that we achieve social equity in Michigan. So we're focused on that as well. I think I'll just end there. Cool. Thank you.
All right, thank you so much, Annie. It's really wonderful to have an advocate like Senator Irwin's and yours on our side. He's been a champion of progressive drug policies for as long as I can remember. And so to have his support is really just, we're grateful beyond measure. We are also really grateful for the support of one Representative Yusuf Rabi. He is going to speak briefly about his involvement in past drug policy efforts, his support for the decriminalization of drug possession, and similar to what Annie had shared with us, other state level and local level drug policy efforts we should know about. So I'm going to turn the floor over to Representative Rabi, and you're off mute. Perfect.
Great. You ready for me? Can you hear me?
Yep, we can hear you.
Okay, great. Well, thank you so much for having me here, and greetings to all of you. Sorry I could not be there in person, but it's an honor to be joining you today and to help push for this effort. Now, obviously, we've had a lot of great conversations about the work that you're doing on decriminalizing possession of all drugs. And that's something that, I think is a huge, the reason that I'm involved in this space fundamentally is around criminal justice reform. It's around making sure that the war on drugs, which is an inherently racist war, ends. And it ends for all the reasons that everybody in this room and on Zoom know full well. Because it's a racist war, we have seen the incarceration of our Black and Latino brothers and sisters at unacceptable levels. That is a problem that persists today. And even as we've legalized cannabis in the state of Michigan for adult use, it is a problem that persists. Because if you look across our prison and jail system, you will see that 60% of the population that's incarcerated is still Black and Latino for drug offenses. drug offenses that are now legal by and large under the passage of Proposal 1. And so we need to change that. And in the words of, those of you that were at Hash Bash a couple years ago at our last in-person one, you heard my colleague, and I will always repeat these words for anybody that, anytime I have an opportunity to. Sheldon Neely, who's the current mayor of Flint, he was a colleague of mine in the House of Representatives. He came to Hash Bash and he said, we freed the weed, now we need to free the people. And that to me is the next phase of our work is on criminal justice reform. So that's why I've introduced legislation last term around expungement. We need to not only get people out of jail that are currently in jail, but we also, for those that are back in our communities that still have a record, a misdemeanor or a felony on record that's preventing them from getting a job or from getting housing. We need to help them to clear their record so that they've already paid their debt to society. And we need them, back able to get the jobs and get housing. It is completely unfair for our society to continue punishing people that have already paid their debt to society. And we have legislation that passed that was signed into law by the governor last term in 2020 that does just that. It creates an automatic expungement system. My bill shortens the wait period that people have to wait before they can get their records expunged. And we passed laws around expungement for use and possession of cannabis. Now, it didn't go far enough because we would have loved to see an expansion. Senator Irwin also had a bill that was passed around cannabis during that time as well. So, we've been doing a lot of work on criminal justice reform. More recently, actually last week, I introduced a bill to fully deschedule cannabis in the state of Michigan. It is a legal substance. It is something that the voters said we want adult use in the state of Michigan, and yet is still a Schedule I substance in our state public health code. And yes, it is a Schedule I substance nationally as well. That also needs to change. I'm not currently in Congress, so that's not something that I have the ability to change, but obviously would advocate for that to change at the federal level. What I can do is push for that at the state level. And that's why I've introduced this legislation. It's not a reduction in the schedule. It is a full descheduling. There is no reason why cannabis needs to be criminalized. And furthermore, looking at the impacts that this has on all other parts of our law. Think of things like CPS cases. CPS workers now can enter somebody's house and take somebody's children away on the basis that they're using cannabis, even if they're medical users, even if they're legally using it under adult use. That needs to change, and that can change if we deschedule cannabis. In terms of what you're working on with decriminalizing possession, this is, again, it's about criminal justice reform. It is not the people who have the drugs for their own personal use that are that should be criminalized. Oftentimes, there are folks that that sometimes, in some cases, they may need help, and that help may not come in the form of putting them in jail and further criminalizing them. It's only going to make the situation worse. And so that's the focus. That's the lens that we should be having here. Instead of crime and punishment, it should be, helping people and looking at, people who are in possession of all kinds of Schedule I or Schedule II substances as humans, as neighbors, as family members, as people that we need to work with. And in many cases, like in the case of cannabis or psilocybin, there's so many medical uses. There's so many reasons why those should just be legal to begin with. And they are truly substances that, and I said this at the rally that we had that was similar to Hash Bash, but for shrooms, for psilocybin, Decrim Nature was an amazing, Entheofest, thank you. That was an amazing event. One of the things I said there is part of the reason why these substances are criminalized, when you look at psilocybin, when you look at cannabis, when you look at some of these other things, is because they are such powerfully effective substances at curing various human health conditions, that the drug industry does not want people to have access to these types of things that can grow in their backyard, that they can have access to. They want people to have to rely on going to the drugstore and on paying out the nose for pharmaceuticals that probably won't help them, that will probably get them addicted, like the opioid epidemic did. And that is one of the real reasons that we're looking at the further criminalization of these substances. It's not because they're necessarily bad for you or dangerous. It's because the drug industry does not want people to have access to medicine that can actually heal them. They want the monopoly on that. So we've got a lot of work to do. I'm glad that you're all in this, and I'm 100% with you in your effort to push for full decriminalization of all substances. That is what we need to be looking at. Again, those that are in possession for personal use are not the criminals here. It is not right that we continue to persecute, and we need to end the war on drugs. Somebody in the chat said, end the war on families. That's exactly right. So again, thank you for having me here today, and I'm happy to join in this effort.
Yeah, thank you so much, Representative Robbie. If you wouldn't mind, could I ask you just a couple follow-up questions?
Absolutely.
Thank you. We have just a little bit of spare time, so I figured that I would love to hear from you if you have any tips for folks in the audience about how to best advocate for these policies, either to decision makers as we start meeting with city councilors and with folks who are holding elected office, or with just everyday residents, citizens, friends, and family.
Yeah. I think telling the personal stories is key, like making sure that that policymakers are connecting with the real world impacts that the war on drug has had, and making sure that policymakers understand what it means on a day-to-day basis for folks to be prosecuted in the way that they have been. And I think that really makes an impact. A lot of people think that statistics, are what sways legislators, but oftentimes it's those personal stories that will change the minds of people. And it's also framing. It's making sure that you frame these arguments in such a way that policymakers understand it in the lens that each of them have. Many of them are passionate about different areas. Some people are passionate about the environment. Some people are passionate about healthcare. Some people are passionate about criminal justice reform. And putting this effort in the lens of those priorities really, I think, will help you in the end to frame a case that will ultimately help you to be successful. And I also think I think you're doing the right thing, starting locally, starting at city councils. Ann Arbor is a great place to start, but ultimately, branching out to other places around the state, for these efforts, I think is spot on. That's the way that you should be doing it.
Thank you for that. I appreciate it. We definitely think that Ann Arbor is step one and square one. It would be unjust if we started and stopped with Ann Arbor. And when this resolution passes, we will then set our sights to other municipalities in the area, and then hopefully one day the county and the state level. We have a little bit of time left. Do you have any concluding remarks, Representative Robbie?
Yes, thank you. That was pretty much what I came on to say. The only others. Oh, my camera's off. I'm sorry about that.
You're fine.
Zoom world. No, I don't think there's really much else to say. Look, I'm with you guys. I want to be helpful in whatever way I can. Jeff Irwin and I have been partners on this, and I'm glad that he's, and Annie is there to as well. We're all part of the team. We all want to help with this. And it's about the future that we want. Like, do we want a future that's controlled by, big corporations that are, forcing people, that are getting people hooked on their substances so that, they can turn a profit? Or do we want a future where, we have basic freedoms in this country, and we're not criminalizing, plants, and we're not criminalizing people, and we're not criminalizing families? And I think that's the bottom line here. So what you're doing is about our future, and it's about building a better Michigan for all. So thank you for, sticking with it, and keep up the good work.
My goodness. Thank you so much, Representative Robbie. Yeah, in person and on Zoom, let's give him a hand. Thank you much. And next in our line of speakers, we have Ashley Shukate from Public Health Awakened, and I'm just going to briefly return to our slides to give everyone a sneak peek of what we're going to be talking about. All right. And I will stand here awkwardly and man the clicker while Ashley speaks. Ashley, you can go ahead and take it away. And since we are running a little early on time, if you want like 10 minutes for this, that's perfectly all right.
All right, I'm gonna just run through and kind of hit on some key points. Anything I have, I will provide ample amount of evidence if anything seems kind of contrary to what our typical society says about drugs, drug courts, and just the overall framing of decriminalization. So my name's Ashley. I go by she, her pronouns. I am with Public Health Awaken Michigan. We're a network of over 200 public health professionals and advocates with a range of living and academic experiences throughout the state of Michigan, with many members living and working in Ann Arbor. I'm a harm reductionist by heart through lived experience as a person who uses drugs, but my background is in healthcare and public health. I ask, that we hold space tonight for this, really thinking about those who do not have the privilege that we do to be here, for those who are caught in the endless cycles of criminalization, for ultimately being a human being. When systems of carceral violence are renamed and repackaged, we must question if it is equitable and just. These labels of alternatives to incarceration, substitutes for drug decriminalization, and claimed public health approaches are inequities highlighting a few successful outliers that promote individualistic blame and stigma that hinder healing, recovery, and contribute to worsening drug poisoning crises that we're currently facing. For background, the United States criminalizes substance use and sex work, further pushes individuals into poverty while increasing trauma, economic exclusion, and negative health outcomes, including incarceration, morbidity, and mortality rates. People use drugs for different reasons. There is a spectrum of usage, and that can change over time. People sell drugs for a variety of reasons. Many of them are just trying to survive, and the majority of substance use is not problematic or a default for a substance use disorder diagnosis, nor justification for coercive treatment and punitive responses. Our drug supply is a cat and mouse game. That prohibition and the racist war on people who use drugs are continuously playing, killing us disproportionately. So why are drug courts not an alternative solution? So drug courts vary in practice, with rebranding throughout, this diversion, deflection programs, ignoring the fundamental flaws in design and structure. While Ann Arbor courts can champion these programs with simplistic measures like individuals diverted from incarceration, this does not identify nor does it use their unintended consequences of weaknesses, nor does it acknowledge the consumption of scarce resources taken from community groups that are led by impacted individuals that have less overhead costs and a higher return on investment. Drug courts appear to manifest some of those same racial disparities that exist with other parts of the criminal legal system. Drug courts generally do a poor job of collecting and reporting relevant data, but what limited numbers are available indicate that people of color are less likely to be admitted to drug court, are less likely to be successfully a graduate of drug court, and are more likely to receive punitive sanctions for failing drug court. Drug courts do not accept individuals with moderate to severe mental illness, complex, and medical histories. So drug courts largely fail at just really providing treatment for those who need it. It fills up that limited space for treatment for individuals who actually need the treatment for a substance use disorder. When the drug courts are focused on abstinence, moralistic failings, they're really failing to provide these gold standard evidence in substance use disorder treatment. So drug courts systematically rely on jail sanctions as a result to return to use, which really contradicts the fundamental principles of medicine and public health. In addition, drug courts frequently jail people who violate technical program rules like attendance at Narcotics Anonymous meetings, failure to pay for urine drug screens, and failure to be remorseful for using a substance. So within the Washtenaw County Drug Court Participant Handbook, requirements are, the participants are required to come to these recovery meetings. The list of the meetings, however, though, are based around this 12-step ideology. This violates many federal court decisions that rule 12-step AANA as a religious organization and violates a long-standing U.S. court ruling that declares it's a violation of the First Amendment rights to require individuals within these systems to attend religious meetings. And with this, it also is working outside of medical standards and how they individuals are detoxed and how they're administered and tapered from the gold standard medication for opioid use disorder, resulting in many fatal overdoses. Sadly, drug court programs, a lot of participants end up serving more time behind bars than those whose cases are handled by conventional criminal courts. To enroll in drug court, you must sign away your rights. This means you are no longer a defendant, but a participant required to plead guilty as a condition of being a program participant, which means that even people who are factually innocent of any drug law violation might end up behind bars and suffer the collateral consequences of a criminal conviction if they do not complete the program. Substance use treatment starts with a plan, and that's created by individuals on their own language that's consistent with their values, their culture, their beliefs, and goals. Really, to make a difference with treatment, we need to focus on emphasizing that individual autonomy, shared decision-making, informed consent, and ultimately address the major gaps within individual levels of care as we dismantle and redesign our broken healthcare and treatment systems. Drug courts cannot do this for us. Drug courts are just an extension of carceral systems that are ultimately increasing stigma and reducing access to care. If we really want to position ourselves in Ann Arbor as leaders in this space of evidence, public health, healthcare, we have to require that best practices are based on evidence. We're following the guidelines, and we're really, acknowledging and addressing the structural, systemic, and institutional root causes to eliminate the narratives that further stigma, discrimination towards historically oppressed communities. We hope that we're able to move things forward and not just plant medicine and not just in terms of, people being able to seek treatment, but really as a whole, focusing on that shared leadership and power with people who are using drugs. That way their expertise can help cultivate a co-designed community response to where we're helping individuals instead of the punitive policies and practices that currently take place. Thank you.
Thank you, Ashley. Let's give her a hand. Thank you for reminding me to turn on my video. I appreciate it. I couldn't have put it better myself, Ashley. Often drug courts are thought of as the humane alternative to incarceration, and that might sound all good and well to someone who has not been in drug court themselves or has not had a relative or a friend who has, who could probably tell you very differently. So as we begin advocating for this resolution, we are going to have to disabuse some people, our friends and neighbors and family, of the idea that drug courts are an effective solution. So we are really grateful for the information that Ashley shared. Our SSDP chapter has also compiled a nice little brief on the ineffectiveness of drug courts, which we'd be happy to share with participants later, so that we can all arm ourselves, as Ashley was saying, with the evidence and the knowledge to raise people's awareness of the needs of our community. So with that, I think we will move on to Julie Barron from Decriminalize Nature. Whenever you're ready, Julie.
Hi, everybody. So happy to be here with all of you today. Really grateful to be asked to speak here and really grateful and honored to be amongst these wonderful speakers that we have today. So I am a therapist. That's what I do. That's my job. That's my training. That's my passion. And I devoted my work about 10 years ago to psychedelic preparation and integration. And one of the things that became really evident to me was that there's more to the healing that needs to happen, more than what happens inside the one-on-one therapy setting. And specifically around psychedelics, I see a lot of my clients were very isolated and really didn't have people to even have these discussions with or talk about their experiences with. And I created Michigan Psychedelic Society based on that need for community. And out of that Michigan Psychedelic Society for many, many years, one of our goals was working towards decriminalization or legalization. And really, drugs in general was really the overall goal. Psychedelics and extended to all substances is really the core belief of that organization. But like you guys, we also realized that Ann Arbor was really a good place. This is like, a good place to start here in Michigan. And so, and so what I want to say is that the crossover for me is about healing, right? I'm a healer. And so to me, I'm not a politician. I had never been to city council meetings. I voted. That was pretty much the extent of my political interaction. And here I find myself very, very passionate about something I see in my work, something that's desperately needed, right? And not wanting clients to have to hide or think or be criminals because they're trying to use some substances to help them feel better or to heal or because they want to, right? And so I'm learning. I learned through the process of working with Decriminalize Nature Ann Arbor. And so we started building relationships with city council members in Ann Arbor, which was really lovely to do. I have met some just really great people and really getting engaged. And an education campaign is sort of what started with like a 6-month weekly emails to city council, going to their talks, engaging with them directly, trying to just open the conversation about these substances and get some information involved. And so really, but I want to be really clear is that we started with entheogenic plant and fungi decriminalization, but that's not because we think that they're the best and they're the only acceptable substances to use, but because we thought that was a really, really good place to start. And it turns out that was true. It is a really, really good place to start, but it's not the place that we end, right? It's just a starting point. And so we were successful in Ann Arbor, and then we were able to extend our reach and start working with other cities throughout the state of Ann Arbor when we became Decriminalize Nature Michigan. And worked with Jeff Irwin's office, as was stated earlier by Annie, to introduce Senate Bill 631, which was really wonderful. We, the bill kind of stalled. And so, we organized at the beginning as a political campaign, as a ballot question, because we thought we want to do it through the Senate or through the House. But we're prepared to go to the voters if we need to. And it turned out that it was heading that direction. And so we've spent the last many months writing language and working to get it approved through the State Board of Canvassers. And we are very close to that. We should be approved by Friday. And then we have a very short window to start collecting signatures for the 2022 ballot. Let me share a little bit about that with you, what that includes, what that language includes. So one, it's decriminalizing entheogenic plants and fungi, use, possession, cultivation, and also the ability to offer services, right? Like some support or some spiritual services to someone who may be wanting to experience them and want some expert help. Sales and distribution are, now I'm trying to remember, is sale and distribution. I think we included sales and distribution, and Jason, help me remember, and Kat, but I think it's by individual persons, by natural persons only, not by corporations. And we were very explicit in our language about that. So yeah, so that's the first, entheogenic decriminalization. Yeah, exactly, not for the weed lobby, exactly, yes. And then, so thank you, Jason. So the second thing I'll say, aside from decrim of all plants and fungi for natural persons, that churches and entities appointed by hospitals are going to be able to sell, grow, sell, and administer. Okay, and then the third point I will say from this language is that we are in such a way defelonizing all substance use and possession, so that there's no life sentences. You know, there's going to be no felony charges for someone who is using or has possession of any substance. And then the last one is we are gonna hopefully, I think it's decriminalized. I don't think it's legalized. I think it's decriminalized testing equipment for substances, so you can, you know, find out what you have, right? That's a harm reduction thing. So that's what our language looks like. And, you know, as a therapist, I see people using substances in and out. Oh, let's go back. Individuals will not be penalized for sharing, delivering, cultivating, or otherwise growing or gifting. A not-for-profit entity will be allowed to engage in, no for-profit entity will be able to engage in sales. Okay, thank you, Jason, for clarifying with us. It's funny because we go back and forth with the language so much. I'm like, wait, what did we finalize here? Yeah, I see people using substances all day, every day in my practice. And if I was to say, you have to, you know, you can't use any substances to walk in this door, then I am leaving out all kinds of people from actually getting help, right? So the harm reduction approach is start with where people are and don't make demands about how they can or cannot show up to you. You accept them as they show up, right? So this idea of the top-down approach of trying to control people's drug use is just ridiculous, and that's what you guys have been talking about. And I see it in my practice every day. It's completely a backwards way of working with people. And so what I want to share with you, the last thing I want to say is that our ballot team, our ballot campaign is under the name Michigan Initiative for Community Healing. It's a partnership between Decriminalize Nature Michigan, Decriminalize Nature National, Students for Sensible Drug Policy, and People for Healthy Choices. And so we, like I said, we're going to start signature collection here on Friday. We need everybody involved. So I will quickly put a link up for the training. If you'd like to be a signature gatherer, we'd love for you to join our volunteer team. There's a training on the 22nd. And we're going to start, and we need donations. And so please donate to us. You can find the link on decriminaturemi.org. We have a fundraiser tomorrow here in Ann Arbor. If you'd like to join us, we're calling it St. Psilocybin Day. It's an educational event and fundraiser, and just have a lot of fun here at Vibe, which is a soon-to-be cannabis social spot. So you can always reach out for more information. I really look forward to working with all of you in the future, because it takes all of us to do this great work that we're doing. So thank you so much.
All right, thank you very much, Julie. Let's give her a round of applause. Yeah, very, very well put, Julie. And you better believe that SSDP is going to be working right along with you to turn out Ann Arbor for the Michigan Initiative for Community Healing and get that ballot initiative passed. So thank you for telling us about that a little. All right, and with that, thus concludes the list of speakers. But before we turn everyone loose to advocate for sensible drug policy in your community, we wanted to give just a little bit of information, impart some information about how to be an effective advocate. And before we do that, we just want to give a quick update of where our campaign is at right now. So if my computer will cooperate and if I will turn my video back on. All right. There we go. Okay. So yes, as of right now, our campaign has had some positive momentum, and it's really events like these that are trying to kick things into the second gear. As of right now, we have built partnerships with addiction treatment agencies. So we were very happy to meet with folks from Dawn Farm, from Home of New Vision, and from Michigan Progressive Health as we were putting our resolution together. They really helped to inform the aspect of our resolution where we're diverting the resources no longer spent on enforcing certain drug crimes into evidence-based recovery services. So we're extremely grateful for their support. We also have been meeting with local social justice organizations. We hope to connect soon with the Coalition to Re-envision or for Re-envisioning Our Safety, or CROSS, and Care Not Cops, another great abolitionist organization at the University of Michigan campus. Slides already pretty packed, so there are a couple of organizations that unfortunately we had to leave out, but we're really grateful for their support as well. We've met with 3 city councilors so far. We've met with 5 city councilors so far, 3 of whom have expressed support for our resolution. Those are councilors Lynn Song, Kathy Griswold, and Elizabeth Nelson. We've also met with councilors Travis Radina and Lisa Dish. And while they aren't where we want them to be right now, we're confident that if we can have some dialogue with them, and if their constituents see that Ann Arbor is ready for sensible drug policies, that we might just be able to change their mind. So we are absolutely not writing off them or anyone else. And it's also not on the slide, but I want to give a shout out to City Council candidate for Ward 1, Cynthia Harrison, who we forwarded the resolution to a few days ago, and not only supports it, but wants to champion it as part of her campaign. So we are looking forward to meeting with Cynthia Harrison at the very earliest possible opportunity. Unfortunately, she couldn't speak or be here today because of a prior engagement, but I just wanted to give her a quick shout out as well. We also have support from other local politicians. We've already heard from Annie from State Senator Irwin's office. We've heard from Yusuf Rabi. Washtenaw County Commissioner Justin Hodge is also supportive of us, and they have been instrumental to helping get this campaign off the ground. So I want to thank them for their support too. And so really what we need now are outreach from residents to every liberal vote at council, which means every vote at council, because this is Ann Arbor, Michigan. And this is where social change efforts often start. So really, we want to go from 3 supporters in private meetings with city councilors to 9, 10, even 11 yes votes in favor of the resolution to advance sensible drug policy. So we're just going to briefly go over how we best believe that can be accomplished. How to be a good advocate for the resolution. So this really pertains to what to do if you are speaking on the phone with the city councilor, emailing them, writing a letter to them, or appearing before public comments. The first thing you always want to do is know which ward you live in, and then make sure to state which ward you live in during your comments so that the appropriate counselors know when to kind of perk up their ears. We also want to encourage everyone to be polite but firm and speak or write in an even tone. So you're not dressing down an employee, you're not begging before the king. You are a citizen who is expressing their beliefs and their concerns to someone whom they elected to represent them. Also to stick with one issue at a time. So we're here advocating for the resolution to advance sensible drug policy. Everyone on this call, I'm sure, are very liberal-minded and broad-minded people who have a lot of issues that we're passionate about, and that's great. And political science research has just shown that legislators are more responsive if you stick to one issue at a time. So we're going to ask, if you advocate for the resolution, stick to the resolution. And then whatever your opinion of a given city councilor, making your comments as an invitation instead of a confrontation is likelier to win them over. So I have a lot of admiration for our current crop of city councilors. Most of the time, they do things that I think are in line with progressive values, and we want to reward them when that happens. There's a principle in DBT, dialectical behavioral therapy, about reinforcing the behaviors that you want to see. So if a city councilor was not supportive of a certain drug policy initiative in the past, we don't need to bring that up necessarily. We really want to stay focused on the present and what they can do for us and for our cause in the future. Just a couple more notes. So if you're preparing a statement for a city council meeting, just make sure to that your remarks don't exceed 3 minutes. That's the maximum amount of time that you're allotted. So write your remarks and practice them in front of the mirror. Focus on the future. We already kind of touched upon that, but we really want to speak in terms of what we as citizens in conjunction with City Council can do for the future of Ann Arbor. We don't want to get too bogged down on this vote or that from the past. We also really want to make it personal. I think it was Annie who said that politicians are often persuaded by personal stories, not necessarily by statistics. It's great if you can back it up with statistics, but if you can attest from your personal experience or from the personal experience of a friend or family member, if you have their permission, that really is going to tug on people's heartstrings and connect with them at the more human level. So we really want to make sure as much as possible to incorporate that into our outreach. And with that, thus ends our tips. And our three main ways to get involved, as we mentioned, are speaking before City Council, emailing or writing a letter to City Council, and calling your City Councilor. So with that, that pretty much ends the speaking element of tonight's event. I'm really grateful for everyone who's here in attendance, in person and on Zoom. And what we're gonna do now is hold some space for really getting this campaign started. So I'm gonna move to the next slide. And here you can see we've blocked off a little bit of time for it. Just real quick, by a show of hands, raise your hand if you are a member of Students for Sensible Drug Policy at the University of Michigan's Executive Board. All right, a few people, raise your hand if you are not. And raise your hand if you are on Zoom as well, if you are not a member of SSDP's Executive Board. I am seeing a lot of hands, folks. So really what this means is that we have here among the participants in this room and folks on Zoom, the start of a movement. People who are regular citizens of Ann Arbor who are ready to reach out and to get this campaign started. So what we want to empower people to do starting right now is to pick a venue for communicating with counselors, whether that's speaking at a meeting, emailing, or calling, and to really get this started, get this show on the road. So to that end, I'm just mousing over it right now. We have prepared for everyone at this meeting what we're calling the Ann Arbor Citizens Guide, which is a short document going over some of the best tips and tricks for engaging with City Council on this issue. And we also have some paper copies for those of us in the room. And we just want to devote the next 20 or so minutes to everyone looking it over and getting started, whether that's drafting your email that you're going to send tomorrow morning or writing the script to a phone call, and you'll call them during business hours and not at 7:27 p.m. or signing up for public comments. So any of those options are available to you. We really want to devote the next 20 or so minutes to kicking things off. So with that, I think I'm going to pause the recording. And if we have any members of the media in the audience, I'm just going to put my contact information in the chat real quick so that you can get a hold of us there. But let's get these guides passed out. Let's get some emails drafted, some phone calls drafted, and let's pass the resolution to advance sensible drug policy. Can I get a hell yeah? Hell yeah. Hell yeah. Can I get a hell yeah? Hell yeah. There we go. All right. Thank you so much, everybody. We're going to get this rolling, and thanks so much for your time, everyone. You pause there. There we go.